I've been really moved by working with a couple of individuals who have described having these epiphany moments. And it's just such a privilege to observe. As a therapist doing EMDR, you're really non-invasive. They follow, the client is doing the hard work themselves. Their brain is working to heal itself. And it's such a pleasure to be able to observe the linking up of the adaptive information with the unprocessed kind of memory networks. So often it can be very quick. So in a number of sets, and even in one session, someone can report their distress from a 10 down to a 1 or even a 0. So it can be really quick. And what's even more remarkable is sometimes as a clinician using EMDR, the client doesn't have to talk about their traumas. You don't have to describe in detail, which is often very helpful for someone who might feel quite ashamed of what's happened to them. So it's just about holding an image in mind. I don't need to know the intricate details of that memory.
So unlike most therapy, it's quite private in a way.
It is, yeah. And there are some therapeutic models that, so for example, narrative exposure therapy or prolonged exposure, that require you to tell every single detail of the traumatic event. But with EMDR, you don't have to do that. Some people have shown a preference for being treated with EMDR over something like trauma-focused CBT or prolonged exposure because of that privacy, and sometimes shame can really get in the way of us sharing our experiences with people. So despite me not necessarily knowing 100% of the details of someone's life history, just being able to observe the transformation in them and started thinking about themselves in different ways or relating to the traumatic incident in a different way is really empowering for them and such an honor and privilege.
You are listening to the Thinking Mind podcast.